Hi, for those of you that don't know me, my name's Mark. I'm a paramedic with Wilderness Medics, and we're going to talk to you today about how I personally treat COVID patients with minimizing the contact between me, my partner, and the patient. It's going to seem a little odd and a little strange because for years we've always been taught that we treat our patients from in front, but we're not going to do that anymore, and I'm going to show you how I treat a patient from behind. A couple of other things to think about is we've all been told that we can't do any SVN treatments anymore because of the droplet precautions. Well, if we stand upwind and the patient needs an SVN, there's no reason why we can't administer the SVN from behind and actually even have the patient turn the regulator on and almost administer their own SVN. Another thing to think about is if we're not in a position where that's possible, we can use magnesium sulfate at 2 grams in 50 cc's as normal saline, administered over 10 minutes. There's just a few other things to think about, and this video is going to explain them all. So I hope you enjoy it, and I hope you learn a few things. Thank you. All right, we want to make sure that we're wearing our PPE when we deal with patients, either an N95 mask or an N100. I prefer the N100, but for the purposes of this video, I'm not going to be wearing them so you can understand me and hear me clearly. So keep in mind, anytime we treat a patient, whether it's from in front or behind, we're going to wear our PPE. In this video, I'm not going to have gloves or a mask just for purposes of this video. All right. A droplet mask is a great barrier to put on your patient if they're not in need of oxygen. By now, we all know the COVID symptoms range a gamut from anything from GI problems to a rash. But if the patient is not having any respiratory compromise issues, let's go ahead and use a droplet mask. We would also be able to use a non-rebreather to prevent droplets from forming. And later on, I'll talk to you about the SVN. All right, because baseball hats hold in heat and body temperature and can give you a false reading with the digital thermometer, I'm going to go ahead and remove the patient's baseball hat, noticing how I'm not standing directly in front of my patient at all, ever. I can run the whole patient questionnaire, all of their demographic information, everything from standing here. Now, I always tell my patient, for both of our safety and because of COVID, I'm going to go ahead and stand behind you. And the first thing I'm going to do is I'm going to place a droplet mask on you. We can do this simply by reaching in front of the patient, looping it over their ears, and asking them to go ahead and pinch it across their nose and form a seal. This will protect my partner and myself. We can also treat the patient from behind. We can take a temperature simply by reaching around the front and getting a temperature. Normally, I would be standing off to the side, questioning the patient, getting their demographic information, their allergies, and their medical history. For the purpose of this video, and because my partner's filming, I'm gonna go ahead and play the EMT and the paramedic. We don't have to be standing in front to put on a blood pressure cuff. We can do it from right here. We don't have to be standing in front to put on a monitor. We could ask the patient to unbutton their own shirt, and then we can reach in and put the leads on the patient while keeping ourselves out of the direct flow of droplets. Another thing that I like to do is think about this. There's no reason why I can't start an IV from here. Absolutely none at all. This is just habits that we've gotten into over the years by being socially correct, and through good patient care, we've always spaced our patients so they can see us. With COVID, this is something we really don't want to do anymore. We really want to limit our droplet exposure. So we're going to do everything from either behind or at a 45-degree angle off to the side. All right, I'm not going to take the SVN out of the bag, and I think we all know how an SVN works. So if my patient did need an SVN, I would simply hook up the tubing, have the bottle on, and tell them, when I tell you it's okay, please turn the dial over to 8. Now, the SVN, just like I said, we're going to stand upwind and behind the patient to prevent the droplets. So once I do have this all set up, I'd hand it to the patient and say, hey, look, I'm going to have you put this in your mouth and breathe, or I'll hook it to a non-rebreather, which is what I prefer. I'm going to go ahead and place the non-rebreather with the SVN on it over the patient's mouth and face and have him turn the dial. This is going to limit, again, our droplet exposure. And that's the whole idea of treating patients from behind and from a 45-degree angle. I want to limit my exposure and my partner's exposure. This video didn't cover absolutely every scenario, and it didn't come close to covering every single patient you'll run into, but hopefully it gave you a few ideas of how to treat a patient from behind, how to limit your droplet exposure, and how to effectively treat your patient and make them feel comfortable at the same time. Remember, we're going to have to explain to a patient that we're going to treat you from behind and to the side for our own safety. And with everyone being aware of COVID, so far I've never had anybody have a problem with it. I'd like to take a minute to thank J3 Contracting for lending us a crew member. And Chris, thanks for being our patient today. And everybody have a great day. Stay safe out on the fire line. And remember, let's limit the droplet exposure.